Good afternoon. I'm Jerry Bigby from the Boise State University School of Nursing, and it's my pleasure to welcome you to the Brown Bag Research Seminar, our last one for the year. And I'll be welcoming our scholars here today. That is Dr. Gail Girding and Faye Carlson, both faculty in the School of Nursing, and they will be presenting some of their research related to the examination of characteristics of child sexual assault cases in Idaho. Dr. Girding.
Thank you. I'm not real good with microphones, so. Okay. Well, welcome, everybody. I kind of knew it would be a slim crowd. A couple things going on today. Not to mention our topic is not the, most people don't find it of great interest. However, Faye and I do. And one of the things that she discovered at WIN was that many people asked her, how could you do this research? Which is interesting because right now we don't even talk to children, and I don't have any desire to. She may at some point want to. But anyway, this research is, we're still kind of in this. We're beyond proposal, and we have just started collecting data, which is one of the problems of doing research with child sexual assault, is getting that entree into the agencies, institutions, and people who work with children who have been sexually assaulted. And most of the research that is done on adults who have been sexually assaulted as children, and it's their retrospective thoughts and ideas and memories about child sexual assault. So this was a little bit different. We initially wanted to look at how child sexual assault functions within the system and then gets prosecuted. But the Ada County prosecutor who works with child sexual assault really told us we would not be able to get to the data we wanted to. But what she needed to know was, what do children look like in Idaho who have been assaulted? And so from that point, we began to talk to different agencies. We have a little clicker thing. The purpose of this study was to explore data from multiple agencies across Idaho. And we were really doing this and trying to partner. Right now we have a partnership with CARES here in Boise. We've also partnered with Nampa Family Justice Center. Because we are involved with CARES, we are have our IRB approved through St. Luke's, so that also gives us access to Twin Falls. There's a child advocacy center in Pocatello, and there's a few up north which we have been told to contact. Okay. Nurses can be very instrumental in the treatment and working with children who have been sexually assaulted. They are often the front line where perhaps a family member has brought a child in, and you as the nurse begin to assess different behaviors that these children demonstrate. So you may be the first ones to know something is off and needs to be investigated further. And then nurses play a vital role in the collection of data and evidence from the child in many of the child advocacy centers. In fact, one of our well-known nurses, Margaret Hinbest, works at CARES, and she does a lot of the intakes. So nurses can be critical in making sure that children not only are assessed properly, but then referred appropriately. About 9% of the cases of child maltreatment across the United States are child sexual assault. Literature is very sparse in this particular area, mainly because it's getting to the children, and there's, I would assume it's because they're a vulnerable population, and also because it's not the most talked about topic. And so there are many researchers that look at child sexual assault and believe we are only getting the tip of the iceberg in terms of child sexual assault. Now, when you look at the data, it looks to has been decreasing. But what some of the main researchers feel is people are learning to hide it better, especially in our web-based internet society. So we're seeing probably less actual cases where a child may come forward, but the pornography with children may be getting much greater on the internet. 7% of the cases in Idaho, of the child maltreatment cases in Idaho, are considered child sexual assault. Now, but just for a moment, as we talk about Idaho, it's a very sparsely populated state. Many of our counties are still frontier. If I am a small child in a small city or town in a very sparsely populated frontier county, and I want to come forward and tell somebody that Uncle Joe or my dad has touched me in a way that I didn't like, everybody in that county is going to know pretty quick. And so children pick up on that very easily. So that's an issue in Idaho. And then the other thing that we found just yesterday, or Wednesday I guess it was, data that's collected in all these different places is different data. They collect the data they need to report for nationals, which is the age of the child, the alleged perpetrator in some cases. I'm not sure I can always get that much detail. Where it occurred, sometimes the length of abuse, but that's not always collected across all states. So what they collect is very different. When we met with the administrators of child sexual assault agencies across Idaho, what they want is a central database. Utah is working on something similar to that. So that, to me, seems very doable. But again, you've got to have people willing to work with you. So that's where we are with agencies. So what are the research questions? Well, like I said, initially we were looking at prosecution and how things work, what were the characteristics of those prosecuted versus those that were not. And as I've told you, the Ada County prosecutor said, I can't let you have the data of the people who weren't prosecuted. She can give me all the data about people who were prosecuted, but not the ones that were not. And I asked her, is that confidential? And she said, no, it's not confidentiality. It's about the fact that if I let you look at that and they come up to become prosecuted later, you've interfered with evidence. And I was like, wow, I hadn't even thought of it that way. So that was really very interesting. So we changed our questions a little bit to really look at what is the characteristics of sexual assault across Ada and Canyon counties. We do hope to expand that. Circumstances of disclosure. I'm very fascinated by disclosure because a child won't disclose until they're safe. And children don't disclose, according to the literature. Children, especially the younger they are, may disclose bits at a time as opposed to just telling you everything. That's how children function. It's very difficult to believe a child when they're just giving you pieces. And if you think about the child sexual assault, you've got a child who may be 4 or 5 years old and an adult who says, I've never done that. So, and that's your evidence. Because children who are sexually assaulted develop a relationship with their perpetrator. It's not a rape where they come in, do it, there's evidence, and you can find that evidence. It is a relationship that is developed between the child and the perpetrator. So it's a very different way of gathering evidence, which is why the nurse plays such a critical role. We want to look at some of the trends and patterns. I'll talk about that when I show you a little bit of the data. What are the relationships between the variables and the characteristics? We don't know what they are, and that's one of the things we want to look at. And then what are the similarities and differences across counties? Again, thinking about what they collect and don't collect, because if they're not collecting the same thing, we're not going to be able to do a lot of comparison. But we could identify gaps and then begin to develop a database that might be able to handle the data. How did we do this? Of course, since it's a research, I have to tell you this part too. It's quantitative and descriptive because I'm a quantitative person. That works well for me. Most of this is also considered secondary data. We are not collecting the data. The agencies are giving us the data. We will look at some correlations. We'll look at some chi-square, Mann-Whitney U, t-tests. Again, looking at differences, similarities, what can we find? I have shared with a few people, and I've kind of told Faye a little bit, I'm terrified that our next step is going to have to be qualitative. Yeah, I hear you laughing. Yeah. But however, won't be talking to children. I'm going to let Faye do that. Okay. Expected variables, we were really hoping to look at like the age of the child, disposition, like are they in foster care, are they in their family dyads, composition of the family, report sources, perpetrator characteristics, physical location of the assault, length of the sexual abuse, and if the case was referred for prosecution. When we've gotten data now from CARES, and we will be getting data from Nampa Family Justice. We will not be able to know probably the composition of the family in all cases. CARES doesn't keep that data, but Nampa thinks they can glean that data for us on their intake. Perpetrator characteristics, all we'll know is the relationship to the child. And one of the things I have to learn to say is not perpetrator, but alleged perpetrator, which I'm trying to go there. We will not know the length of the sexual abuse. That, so far, neither place collects that data particularly. Again, why I think I may have to look at other things. Okay, so this is just all I can give you at this point is the descriptive data that we've collected so far from CARES. And not a surprise in Idaho that the majority of children sexually assaulted is 81%. What was interesting is 12% of those cases were multiracial. And that is higher than the national average, I believe. Most of the children sexually assaulted are female. That's pretty normal. Or normal is not really the right word, but that matches national data. One of the things that was interesting to me is most of the children were not in foster care. And I don't know how much you know about foster care, hear things about foster care, but it's not the best system we have in the United States for caring for our children. And many times I hear things about, oh, they get abused in foster care. Well, not necessarily sexually. Although when we look at the slide on the perpetrator, foster sibling is what usually happens in foster care. Yeah. Oh, sorry. Let me go back. I know how to do that, I think. Previous. Okay.
In the multiracial, how is that defined? Is that self-defined?
Yes.
Or is it by their...
It's self-defined. All of these are self-report in the client race. And keep in mind that this is from one agency. And one of the things I guess I need to clarify, this is from CARES here in Boise. They get children referred to them across many counties in Idaho. Now, I didn't specify that for this presentation because there's so few in other counties that this is really about Ada County. But there are multiple children in other counties that get referred to CARES. Yes, ma'am?
Are refugees included in your African American?
I have no idea. Good question. Again, these are the kinds of things that we need to hear from you so we know how to ask when we start getting deeper. Uh-huh. Right. Yes.
When you classify those, the Idaho and the NHANES that we worked on classify Black non-Hispanics.
Mm-hmm.
Are you going to leave it like that?
That's how we get the data. This is not data that we went out and collected. This is data that was given to us and how CARES has collected that data. Okay?
How will you compare that then to national?
We haven't even gotten that far. My guess is those are the kinds of things that we'll have to go back to the agencies and say, do you have it this way or this way? I'm surprised, like you said, that they don't have it Black non-Hispanic because that is the more that's the more current way that that's being collected across the United States.
And Idaho, that's how they're, of course we have none.
Yeah,
But
right. So, okay, we're moving on. I did want to look a little bit at client household income simply because to demonstrate that this is not necessarily an issue in a particular income level. And as you can see, for the most part, it goes up and down. So there's nothing really jumped out. The only thing that really jumped out at me is how many people declined to let them know that. And that, I guess it really shouldn't surprise us because people don't necessarily like to share that. But that was interesting to me. And the alleged victim age, couple explanations here. As you can see, the largest number is from 10 and under, with 6 and under being the largest group. But they also have data on people 18 to 22. And the reason being is when we look at disabilities, and I'm not sure I put that up here, but I will talk about that. Developmental disabilities are something they do gather. And I'm guessing and inferring that many of the ones that are over 18 probably have developmental delay, which is why they're being seen in a children's clinic. But I'm sort of guessing. As I said, one of the things we're very interested in is disclosure. And the reason we have first disclosure here is because just because they've disclosed in a particular place doesn't mean that that case will go any further. If there's really not enough, often they may refer or try to file for prosecution of the alleged perpetrator, but if there's not enough evidence, they can't. And so what they collect, and we don't have that yet, this is first disclosure. And from their anecdotal observations, they know that if this if they don't have enough evidence and they send the child, it's been intake, they've examined the child, know nothing that they can really do, they send the child back to the environment they came from, they will see that child again. And they will then have a second disclosure or more. The other thing that they've noticed is, and I think what Dr. Sexton said, is that sometimes they'll come in for physical abuse, and they may or may not be able to substantiate that, and then later they'll come back for a sexual assault case. Yes?
So is the question that they asked, who did something told about this?
I'm assuming. Again, this is data. We haven't formulated the questions. We haven't even looked at their intakes. This is how they determine who the child first discloses to. So I would imagine that, like in terms of a friend, the child has disclosed to a friend and then gets referred to CARES. And they are asking, how did you know about this? And so that's how they're collecting that data. When you're not in control of the tool, you don't always get the information, which is why we want to look at what's out there. Because one of the things we talked with the intake people at NAMPA was one of the things we hope to help with is developing a tool that's more common across Idaho so that we are collecting the same data. Even if we can't necessarily start a database, we can at least get them all maybe on the same tool. So we'll see. So what I want you to pay attention to is the first disclosure is a parent in most cases. Seems to make sense, right? Okay. Keep that little bar in mind. The most often person that offends is the father. Now, if I'm a child and I'm going to disclose to a parent, but the parent is the perpetrator, how far do you think that's going to go? Those are the kinds of questions that we come up with as we look at things like this. And one of the pieces that I'm very intrigued by, and will, I hope, pursue at some point, is that family composition. We know from literature that more often than, well, many times, if the child discloses to the mother and the father is the perpetrator, the mother will support the father, not the child. And so that becomes a very difficult case to work through, not only for the counselor or the nurse, but for the child. And according to the expert, we have a counselor who's kind of our expert consultant. She actually talks to children. She says probably in her, she said right off the top of my head, she said probably 25% of the time she sees where the family, the mom, if the dad's the perpetrator, the mom will not support the child. And it's the child's fault for the sexual assault. The other, what I wanted to point out, friends often abuse, brother, mother's boyfriend. What did surprise me, where did it go? Stepfather, although they're up there, is not very high on that list. I did actually expect that to be higher.
And I don't see stepmother.
Nope, they probably didn't. Either they didn't report it, or it's not enough to even show up on our list.
But the Disney films all say the stepmother's the best.
Good point. Good point. Yeah. Yeah. What is interesting, though, and I have a colleague who is investigating this, and this is probably child sexual assault is kind of that subject people don't like to talk about anyway. But it's the idea, if I start, my guess is as I started talking to you, all of you thought of a young child that's a female sexually assaulted by a father or an uncle or a brother. Mothers do sexually assault their children. Women do sexually assault children. Not as often, but again, you got to think about what do we know? We think that's what we know. And I have a colleague who has actually done some qualitative research with women that are incarcerated for child sexual assault and their lived experience as children, trying to get a sense of what does that mean. So that's, if child sexual assault is a hard topic for people to talk about, talking about it as the woman doing it is just almost unheard of. People don't.
It made big media in Seattle when the teacher
Mm-hmm.
and the young man over there got
Right. But when you start talking about a mother or a stepmother or a female sister abusing a child, it's rare you're going to see that, even in the media. No, I don't think they said. That could probably be another known person. You really don't want my opinion on that. Okay. So, like I said, ultimately our goal was to really look at some prosecution issues. Disclosure plays a big role in prosecution because how the child discloses is one of the ways they can use that for evidence. Again, there's no physical evidence that says this child or this person has abused this child unless they get that child immediately after the abuse and there's some DNA hanging around. Very rare. So the prosecution is based upon what the child discloses and whether or not anybody can corroborate that. And then you've got so the decision to prosecute rests with that prosecutor. They make judgments about whether or not to prosecute based on whether or not they can succeed. And so most cases never go forward. Now, I thought I had put numbers up here, but I did not. This, as you can see, only a small part were convicted, charges were dropped, or plea. And I don't know why the numbers didn't show up. I thought I had put the numbers in there. This is only 38 people total that make up this over. It was 2007. She did send me the years, by the way. 2000. So for 5 years of data, 38 people from the CARES that have been referred for prosecution and prosecuted. And
Those are the convicted ones.
38 total. That's what makes up this circle. And only of those 15, I believe, is 38, only 15 were actually convicted. 12%, 12 of them pleaded out, and then the rest of the charges were dropped.
Can you tease how many children are dead that they dropped charge or plea?
No. And one of the things that we're not looking at yet are whether or not that child was has had a demise because of the assault. We're not looking at that yet. And the other thing, now in this data and in the data we'll get from NAMPA, although we have brothers and siblings and younger people in that list, our next steps of data, we're probably not going to look at juvenile offenders because there's a whole other gamut of stuff that's involved with juvenile offenders versus people who are considered adults who offend. Now, we will probably get into juvenile offenders because that's where many of the incidents are rising, is in juvenile offenders. Yes, ma'am.
Do you guys know how the rate of prosecution in this one place or in Idaho?
This is just from CARES.
Just from CARES.
Mm-hmm.
How does that compare with sort of like?
I haven't gotten totally that far. I will tell you that we have looked at the state, and I probably should have put that up there. The state, we can look at the state, and over the state, over 5 years, there's like 300 and something that have gone forward. And of those 300, there's only, what, about 128? It's again, a small percentage that are actually prosecuted. And then we have a number that plea out. But it's still, if you look at, this is from 1,300 data points. This is 13 incidences of child abuse, sexual assault from 2007 until 2011, mid-2011. 38 cases. That's why it's a problem. Because that means of those 1,300 children, only 38 of their perpetrators were even brought forward. So we have probably 1,300 perpetrators out there still in Ada County.
So they don't have the evidence, or there's a bottleneck in the system to prosecute?
Both. Mostly they don't have the evidence. Because again, child sexual assault is a very difficult case to prosecute. If the child is not corroborated in their story, the ability to go forward is very limited. In some cases, if the perpetrator has been brought forward before, in the past they've been able to show a pattern. That has had a new precedent judicially. And, I don't know if you know much about, if you watch Law and Order, you can't present cases from back. If they were prosecuted before for something, you can't bring it if it's not pertinent to the case, even though they did the same thing. Well, in child sexual assault, that's been somewhat lenient. They've allowed them to show patterns. The best example I can give you is if we have a child who's 7 years old who's being sexually assaulted by dad, and maybe the teenage daughter who's 17 was also sexually assaulted, but that case never went forward. In the past, they've been able to use the 17-year-olds, because the 17-year-old can't, or probably should use a 20-some-odd-year-old, but if that 17-year-old case never went forward because of lack of evidence, then they've been able to use it in the past to demonstrate a pattern of behavior from this perpetrator. A precedent came out right before we started, so it was probably in winter of 2010, that this one perpetrator's lawyer fought that was illegal to bring cases forward or to show.
How can they do that if they haven't been prosecuted?
Because they have, it'd be like if a child comes into a child advocacy center and there's evidence that, they've examined the child, done an intake. Yes, indeed, the child is saying they were, the dad sexually assaulted, and maybe the prosecutor looked at the case. They were sent for, referred for prosecution. The prosecutor looked at the case. There was some evidence, but not enough to go forward. They knew they weren't going to get a conviction, so they don't go any further. But then, years later, another child comes forward. This man sexually assaulted me. And so then they can say, he came forward at this point. We didn't prosecute, but now he's doing it again. It's showing a pattern. That's really, in the past, that's been somewhat allowed, but it is no longer, it's much more, it really stopped that ability to do that, which then, because perpetrators tend to have patterns, and if children who have been sexually assaulted have come forward, but nothing was available to move it to prosecution, they can show that they've done it. Someone's accused them many times, but there's not enough evidence to move forward. It's very frustrating. Yes, ma'am.
So, do I understand you then, at the state level, 30 to 35% of the cases are brought forward to prosecution, and here in this whole area, 3% are brought forward.
It's something like that. Yeah.
So there's something, just kind of lack of evidence is really, unless we're just really bad, and we're supposed to be really good here at interviewing kids and collecting evidence, something's really different here.
Well, again, I'm glad you asked that question, because I don't hold me to the numbers I just cited. This is 38. Well, you're right. It's still a very low percent because of the numbers. Yeah. Well, apparently something's not right.
Are there different channels that they may have come through in the same area other than CARES, like through the Ada County Prosecutor's Office? Or,
The other channels that the children come through is law enforcement. Like if a mother or the person that the child discloses to may call law enforcement, and then maybe law enforcement calls health and welfare. And maybe that child is never seen at CARES. So yes, there are a few other channels. But in Ada County, once a child is brought forward for sexual assault, and probably they said 90% of the cases or something? A large number of the cases are referred to CARES for examination. But we do know there are some cases that are moved forward that CARES never sees.
What is entered when there's a plea?
Oh, it's lesser plea. It's usually...
But that becomes part of their record.
Yes. So, and they may have to do jail time for a plea, but they are not convicted for the sexual assault charge that they were sent forward with.
Because I just was informed this week that in Idaho, that no matter what's on your record as a youth stays on your record, it's not as fun because when you become an adult. So we have youth juvenile sexual assault and they're pleading, then if they continue it into adulthood, then that could be some kind of evidence.
Sure, as juvenile offenders, yes. Again, but by law, you can't You can't bring that as evidence of prior acts cannot be used as evidence for whatever they're being prosecuted for. And that's what got, like I said, in sexual assault, they used to allow that, and they're not doing it much anymore. There was a case that fought it, and the judge ruled it as unconstitutional, can't bring it forward. So that's really made a big difference. So, yes, Dr. Springer, we have something going on. One of the things that we're working on, like I said, we've just talked with Nampa Family Justice Center. They are working on getting data for us. They actually, I don't think she actually has a big database. She has a little one. So she's going to be gleaning. We showed her some of the variables we were interested in. So she's going to glean those from intakes. And she was, I think, very excited about, she was willing to, well, she has an intern. She goes, oh, it looks like a project for you. And so they will actually be going through intakes. She said they had around 600 or so from 2008 is when she started, I think, collecting data. So we'll get those data points, and we'll be able to do some comparisons. But we're at a loss. This is a very difficult area to get into. We applied for this grant. This was granted to us we started June 1, 2010. The first data we saw was the week before we went to WIN. And then we went to Nampa this week. Now, we've been talking to them all this time, but getting entree is very difficult. You get people who want you to do what you want to do. Like Dr. Sexton at CARES has been extremely helpful, believe it or not. Very helpful man. Rebecca at Nampa, she made room for me on their agenda of child advocacy administrators so we could talk about this. But actually getting our hands on the data has been very difficult. And this is secondary data. I am very clear. I don't even want to know I don't want to know where they live. I only want to know these demographics and these data points, because that's all I want. I don't want to be able to track it back to a child ever at this point. And so it's very de-identified. Now in Idaho, that becomes a little bit different because of the fact we don't have the diversity. So if you have a multiracial child or an African or refugee, you guys might be able to track it back. I wouldn't. So it becomes very difficult in Idaho. We believe we'll be able to get entree to these other advocacy centers simply because they were at this meeting. And there was someone from Coeur d'Alene, but I can't remember. It's not a child advocacy center that's up north, but they see children. And then we want to look at trends and correlations and what are children experiencing in Idaho. And one of the things that we're very interested in, as I said, is looking at these different counties, because I just can only imagine even if I'm 8 years old and I finally decide to disclose, if I'm in a county where mom knows everybody at church and everybody at church knows everybody at school, they're going to know. And imagine, just for a moment, think of yourself at 8 or 9 years old. That would have been terrifying. And disclosure is something that, for a child to disclose, they must feel safe. And what we can't seem to figure out is what's that definition? What makes a child feel safe? Because when they're being assaulted by the people they're supposed to trust, who are supposed to be taking care of them, what does that mean?
So is that your ultimate goal then, to determine what that means and how you can facilitate that occurring for children through nursing intervention?
Yes. I mean, ultimately, I would really like to get into that disclosure piece, which is probably why I'm going to have to do something qualitative. But and then from that disclosure, looking at the prosecution, what can we develop and what can we collect on intake or with children? What can we do to help them feel safe that then will help facilitate that prosecution? And that our county prosecutor, that's what she was all about. What can we learn? So.
What is the safety net provided? So if we have a child who feels safe enough to disclose, and it's the father, and the father's prosecuted, does this child stay at home? Or if it's the father and he's not prosecuted, does the child stay at home? And, the whole education process of 2 children in school age, of what is the other side of it, of how it will affect your life, which children can't understand. And
Just for a moment, I want you to imagine yourself at 8 or 9 years old. Remember when you were 8 or 9 years old. And your parents were they were all about, they were your focus, they were your world. Now granted, at 8 or 9, you're beginning to pay attention to your peers. Your teachers are important to you. But if I disclose to anyone, and some 8-year-olds and 9-year-olds are a little bit more savvy than others, but if I disclose to you, they might take me out of my house. Or if it's daddy, daddy may be taken away. And if daddy's who you know, all those thoughts go through your head. If a child finally does disclose and is pulled out of the home, that's traumatic for the child, because not only am I being assaulted by this person that I love and trust, but now you're pulling me from the only place I know, and you're putting me in a house with strangers. The trauma that we put these children through just continues to grow. And one of the things we do know when we talk to adults who have been sexually assaulted, one of the reasons they don't disclose as children is because they've thought through many of these processes. And it's better, just as with the battered woman, known is better than unknown.
Okay, so I was wondering, eventually, if you're talking to nurses that work at care?
That's the qualitative piece that I know has to be done, and we'll have to talk about that at some point.
The reason I was asking is I would think they would be instrumental in getting the disclosure.
As I was looking at reading literature and thinking this through and talking to Mydell Yeager, who is our partner, she works with these children. And what came to my mind was the people that interview and work with these children know more about their disclosure than anyone else. And so, yes, those are the people I'd have to talk to, the intake people, like the nurses that originally worked, to do the intake and the therapists across Idaho to get a sense of what do we know, because they're the ones that know. And that's not, as much as I would love to hand them a survey and let them check it off, and then I can go put it in my little SPSS and I can run my little numbers. That's not going to necessarily capture what we need to know.
And doesn't this dovetail some of the work that Maxis and Karen have been doing?
Well, it dovetails in the sense that they work more with foster kids. Interesting, like I said, I was very surprised that that's a very small number of places where children are sexually assaulted, but definitely an issue that we can't ignore. So, and Max and I we have talked about this in children, and many of the kids who may be in foster care may have been put in foster care because of they are there usually because of child abuse and neglect or whatever, and sexual assault is probably part of that. So definitely Karen and Max work with children who have sexually assaulted. Yes, ma'am.
Great stuff. Of course, one of my areas of interest, and I'm so excited you're thinking about this, is the rural and frontier areas.
Mm-hmm.
And when you look at where's the entree there, because you look at the agencies, they're all in the urban counties.
Right.
And there are no, for the most part, formal institutions that are dealing with this in rural and frontier areas. So where are you going to go? Are you going to go to the churches? Are you going to go to the schools? Is one aspect, but do you have ideas about how do you access this problem when you don't have these agencies, which again are challenging at times, but if those don't even exist, what do you think?
Well, I have really kind of mulled that over because one of the people that was at our child advocacy meeting was from Coeur d'Alene, I believe. I know it was up north somewhere, and she very clearly stated they do not have this type of agency. They do collect information, and they have a place where children go.
That's an urban county. Yes.
Mydell she's an expert witness, so she's often called to court, and she has testified for cases as far north as McCall. I mean, no, it's not real north, but McCall, and I mean, she lives here. So, we know that these are occurring. If we thought about accessing the schools, again, we're going to have to do a lot of groundwork in terms of the characteristics, because these schools know everybody. And in these counties that I'm just thinking about New Plymouth School, everybody knows everybody. Even some of the parents that are not necessarily as active, people know who they are. So for a child to disclose, and then for somebody like me to walk in and Faye to walk in and go, we're really looking at child sexual assault, we're going to have to develop some strong partnerships with people who are already working in the field. And it's going to not be an easy task. Yes, ma'am?
I was thinking about some work that was done statewide a few years ago that we did on suicide prevention.
Mm-hmm.
And it was a statewide initiative, and I'm thinking that maybe extrapolating from some of that couple of studies to think about. And one was, I'm going to relate it to suicide for just a second, that the county coroners did not have a standardized way of reporting.
Mm-hmm.
Very much because of the same reasons you cited for child sexual assault, which is, I mean, it even included, if I identify this as a kid who took his or her own life, the parents won't get the insurance benefit. I mean, there were multiple
Mm-hmm.
reasons. So one was a standardization of forms, and a lot of work went into that. But the other one that I thought that might be extrapolated here is that, and I don't know the literature like you and Faye, but in the suicide literature, there's two questions you can ask. A nurse can ask as screening questions that are not necessarily highly predictive, but highly related and correlated to a possibility that a child will make an attempt or a completion of suicide. If there's something in the literature where these school nurses are doing the screening with the rest of their screening, ears, eyes, nose, whatever it is that we do in those schools, asking those two suicide predictive questions on a Harvard study that was done, if there's a few of these that can be asked,
Mm-hmm.
and then you're going to pick those kids up early, like we are starting to do with some of the suicide stuff.
One of the issues around that.
Really the role of the nurse.
Right. One of the issues around trying to develop questions that would predict or at least correlate with sexual assault is that sexual assault in children presents in so many different ways that many people that that educate about sexual assault in children, they no longer even put symptoms symptoms and signs on the board because they're so, the gamut is huge. It runs from, visual issues, like with young girls, perhaps they become very sexually aware early, to stomach aches. They come to school, they have stomach aches. I actually briefly worked with a school teacher once who was telling me, she was talking to me about this child who kept coming in all the time with a stomach ache, and she usually was not necessarily dressed appropriately for the weather, but wasn't dressed inappropriately. Stomach aches, and then the nurse made a comment about having urinary tract infections. I said, did any of you ever think that maybe this child is being sexually assaulted? Never crossed their mind. So education of the people that work with children is number one. And then number two is trying to glean from these characteristics, what can we learn that we can ask a child that might lead us down that path. And you're absolutely right. But the problem is that we just really don't have a handle on those characteristics. And that's that.
I think your qualitative study would be awesome to figure out what are the factors that lead to, what are the conditions that lead to disclosure. And then from there, maybe you could think of those one or two questions to ask a child.
I know.
And the other thing that we're doing is also, going back to the suicide thing, is having all nurses do that screening in the doctors, not nurses, whoever those people are that call themselves nurses, that do our screening in our primary health areas, adding in those one or two questions.
Well, it's just like we've learned with domestic violence, learning how and what to ask women that then finally helps them feel comfortable to disclose. And
Another piece of that is recognizing, like you said, your data, that it's not, a particular socioeconomic group,
right.
ethnic group, or something like that.
It's a cross. And that's what makes it, we really don't have characteristics that we can say this, and this. And it becomes very frustrating. And the fact that people don't want to know about it. I mean, truly, people don't want to know. Yes, ma'am, Ms. Terry.
Is there anywhere in the nation that has a higher rate of success in prosecuting child sexual assault? Like, I don't know if there's an underground network that says, for perpetrators, man, you don't want to go to Minneapolis. And maybe being able to drill down on some of their data to see what we would
that's actually where I kind of wanted to go at some point, was really looking across the nation and kind of seeing what's happening in other places. And there is literature already out there that looks at different places and why they were more successful with prosecution. But there's not, right this minute, I'm not sure there's an easy way to do that. Now, some states are, Massachusetts being one, and Utah actually has a very they have a very interesting model that they're using with foster kids that also kind of relates to sexual assault. Massachusetts is working on primary prevention, which is very interesting because how do you prevent something from happening if no one knows that they're perpetrators yet, right? So they have this. What they are working towards too is because it's men they're targeting right now. And they actually have put out calls to the public if you think you have these kind of inclinations or if you get angry, and they do it around anger management kind of things. And they are bringing in men who are self-identified as possibly being perpetrators, and they're working with them. Now that's, a very fascinating direction. And in their anger management, they're getting referrals from courts for people who exhibit, especially young men who are exhibiting some anger issues, into their classrooms to help them learn how to handle anger. Now, anger may or may not be involved with child sexual assault, but at least they're looking at some ways to primarily prevent, because we do know who becomes perpetrators. We have some pretty good ideas about that, and one of them is they've been sexually assaulted somewhere along the line, and it's oftentimes physically abused. And so one of the targets we're looking at is kind of figuring out, okay, you've got this 9 or 10-year-old who's already starting to demonstrate some signs of wanting to be a perpetrator. How can we intervene early? Because if we need to break the cycle way before it ever gets started. And some states are doing a better job of that.
Are you working with anybody else here at Boise State?
Right now it's me and Faye. Selena Carver's on our team. She is a health science person. And then Mydell, who is Yeager, who's she is. I forget why I didn't contact, or maybe I did contact her and she was real busy. I can't remember, but I have been told about her. Right. Mm-hmm. And yeah, I actually can't think of her name right off the bat, but I can't. I think what I initially kind of wrote to her, but I'm not sure we just weren't gelling at that point in time. So, but I definitely need more people, some different eyes, because from my perspective, like I said, it's that qualitative thing looming over my head.
Well, you think she might have a lot of the national data information?
Yeah. Well, and I was sharing a little bit with Dawn yesterday. Finkelhor is kind of the guru of child sexual assault across in the East and across the nation. And there is a database, and I was reading some of it last night, or rereading, I should say, where they have collected data very similar to Breffus and Inhanes with young people as a telephone interview. And so they were able to collect some data about children who were sexually assaulted who had never disclosed, and why they had never disclosed. Finkelhor then repeated that at a different, with a different same age group, little different way, dug a little deeper, and his conclusions were that that we are just barely touching the tip of the iceberg, because these children are not coming forward. And if they're not coming forward, these 1,300 kids may only be, a small percent of children in Idaho who are sexually assaulted, because we really don't know. Because we don't know much about disclosure. How do we help a child feel safe enough to disclose? And is safety the thing that makes them disclose? We don't know. And if we can't get disclosure, we can't figure out what's going on.
Well, if we get them to disclose and then nothing happens anyway, then it's like, why are we?
Well, yeah, exactly.
Well, that was what I was saying. You've shown that of those that ultimately make it into the system, the vast majority disclose to a parent. Well, the parent goes, they're still out there. They disclose, but nothing's ever.
Imagine being 11 years old and your mom telling you, well, it's your fault.
Yeah.
You shouldn't dress like that.
I would think
You shouldn't act like that.
I would think that would be a major deterrent because of if you're even, 7, 6, 7, it's your fault.
Mm-hmm. And even if you're a child who's thinking about, oh my gosh, I know that you're not supposed to be touching me this way, but if I tell, then everything, then maybe daddy will go to prison, or if you're going to tell a parent and it's somebody else that your parents are friends with that's abusing you, oh my gosh, daddy might go kill him, and then I'm losing dad. So children, remember that magical thinking and all of that processing they do with their imaginations, it gets huge. Yes, ma'am.
Well, my mom was a child advocate for a while, working in the courts and trying to help these kids get out of those situations. And those kids needed her. She was
Yep.
they
Yep.
wanted to kill her. They wanted to, make her away because she was taking them out of their home with her. And she did it for about 6 months, and finally said,
Right. It is exhausting.
You've heard the messaging that they shouldn't be touching you that way. That is the norm from early on within your family context. And the scary thing about that is if we are not able to intervene and have them disclose, it just makes another cycle, another generation.
One of the things that has always made me very angry is this push to teach children to say no to the adult. I'm like, oh yeah, right, that works. Let me tell my dad no. Right, works. And then also to be willing to, if somebody touches you inappropriately, go tell somebody, right? That's the push. And I've always been very angry about this. What they have found by teaching children this isn't that they learn to say no to the adult that's perpetrating, but it does help those who are being abused come forward and ask questions. And that's how they're identifying some of them. So there is an upside. So then I relaxed a little bit more over that because I was like, so anyway, that's kind of an interesting sideline to that. Yes, ma'am.
I don't know. Go back to the suicide stuff again because it was with kids. One of the findings in our work was very interesting, and it held up against the national work on it too, which was we were making a lot of mistakes across the country and putting programs together where kids would go talk about their intent to harm themselves with a grown-up, and we found out that kids don't tell grown-ups, they tell other kids. So that started a whole new trend in the United States about 5-10 years ago, originating mostly out of Oregon, where they set up systems where kids could go talk to kids and say, this is what I'm thinking, and then that kid, so if I'm a kid and I tell Pam, my best friend, Pam knows, if she's removed from it, she now knows to go tell a grown-up. So the whole thing got turned upside down, and we saw much higher reporting of suicide, ideation, and attempts. So I don't know if there's any correlation there with kid to kid in
Well,
this context.
the little bit of data that I have read about that, or literature, is where they've talked to older victims who are remembering. And they've asked them, did you ever disclose? And who did you disclose to? And did you disclose to your best friend? And that has not been very, that we've not seen that in the where we have adults talking about their experiences. They don't disclose. And many of them, one of the most interesting, Hawaii has a very interesting system of socialization where people who have been sexually assaulted, they have a center they can come to. And one of the most interesting things that I saw on their data, they had an 85-year-old that came to their center, and it was the first time she had ever disclosed of her sexual assault as a child. So children don't disclose. I mean, it's just because of whatever, and we just really don't know enough about it because there hadn't been the research. Getting the ability to talk to these children who are sexually assaulted is very difficult, and that would just be one more, it's one thing to be the intake person who's gathering that information, but to try to gather that information more pointedly, that's kind of what we want to do, is figure out what might be better questions to ask to really get to what's going on with these kids. We don't know. I mean, I can stand up here and tell you I don't know more than I can tell you what I know.
Well, maybe that should be the focus of intervention, should be once children are known to have been abused, that if we start our intervention at that point, maybe the cycle will.
And that's, like I said, with juvenile offenders, we know that perpetrators have tended to have been either physically abused or sexually abused as children. So trying to figure out early on how to identify those children so that we can intervene and hopefully stop that cycle.
But Mama brings up an excellent point, because if you have a low conviction rate, at least if you have an intervention for those children who had a conviction, if we're not doing anything, that's progress.
Right, and that's what I mean. I'm sorry I'm not articulating that way. They are trying to intervene before they perpetrate. So they're children who are known, like if they've been sexually assaulted, then part of the intervention is to help them learn how to cope again, how to interact socially again, because that's what they don't know how to do. And boys, although boys are not as high a percentage as girls, when we look at disclosure, there's a lot of stigma around a male child disclosing. So that is probably not near how many children, males, are perpetrated on. Yes.
That's consistent with the rate.
Yeah. Yeah.
Well, I can just tell you myself, when my son came to me at 13 and 3 of his friends to disclose about a coach at the high school, I got nowhere. I got nowhere.
Right.
And this guy's been in the school system 32 years. Which is like...
It is just not something that we intervene easily with. People don't want to look at it.
I have another question, and I have an assumption of what the answer is. Of those that get ultimately to prosecution, get convicted, I would anticipate that the success rate is with older children.
No, not necessarily.
No.
See, I busted your assumption. I thought that too. And I guess it's your definition of older. Actually, I think the success rate is around from 4 to 7. Is where we see the best rate, I believe. I think that's what I remember I read. It's 4 to, yeah. I was surprised, because I would have thought it was like the 11 or 12-year-old, because they tend to be more believable, because they're older. They're not making it up. But it may be, again, it may be around who they disclose to and whether or not they're supported by their disclosure. If a 5-year-old discloses to the mom who says, oh my gosh, I'm pulling you out of the situation, we're going to get you in here, we're going to pursue this. And then, because probably the ones that get convicted are the ones that finally admit to it. That's why they plea out, because they're admitting, I did it, okay, I'm sorry, And just as an aside, when a child's perpetrator admits to have perpetrated this child and then is convicted or does some sort of retribution, that child's psychosocial development is much better. They do not have as many of the post-traumatic stress issues. And if they disclose to the mom and the mom is supported, even if nothing else happens, that child is better. It's real interesting, some of those dynamics. I try not to go there. Yeah.
Maybe a squirrel, but anything else have to do with
I like squirrels.
I don't mean to put it up on nothing, but it may not have to do with the jury.
Oh, yeah.